People are expecting us to come up with a solution.
I think the average American doesn't care what flavor the legislation is, as long as it takes care of the challenges they have.
If there's going to be a big idea, that will not happen by January 1, 2026.
Whatever your plan is, we've got to bring the cost down.
I have been saying for months that we have got to reach some sort of a solution on premiums.
We just have to, put our best proposal on the table and see how the chips fall.
Well, tonight in our Common Ground segment, we talk about bipartisan legislation designed to extend health care insurance premium tax credits and reduce the deficit. It's called the Fix-It Act. Joining us tonight are two of its primary supporters, California Democratic Congressman Sam Liccardo and California Republican Congressman Kevin Kiley. Thank you both for being here. Congressman Liccardo, first to you. Some of the plans you've said are unrealistic, and that's one of the reasons why you guys are working together to try to put something forward, right?
Well, actually, there are many good plans. The big difference, I think, between ours and the other plans that have been presented is that ours is actually paid for. We found savings, that is through cutting off the windfalls that insurance companies are making through Medicare Advantage to actually pay for the cost of extending the tax credits.
So this Fix-It Act, Congressman, Affordable Care Act premium tax credit extension for 2 years, caps eligibility at 6 times the poverty level, $192,000 for a family of 4, cracks down on overpayments to Medicare Advantage, to your point, stops fraud by insurance brokers in the program, and the CBO estimates the near-term benefit impact, $55 billion, 10-year fiscal impact, $90 in net savings. You're saying it nets out.
It actually saves us money.
And so is it getting buy-in?
It is, yeah. We keep adding co-sponsors basically every day. We're keeping it bipartisan. We have 5 Republicans, 5 Democrats on board right now. And I think it's a compromise that really can achieve the level of bipartisan support that we'll need to get a deal here. Because as Sam was just saying, what's different from what we're proposing and other proposals that are out there is that we do this in a way that is fiscally responsible, that actually saves money, doesn't increase the deficit. It's temporary. And because there's a pay for, it's inherently limiting in the sense that we're not going to keep extending. We're just providing some runway to find a real long-term solution.
Why can't Senate Democrats get there, Congressman Liccardo?
Well, I would say Senate Democrats and Senate Republicans haven't gotten there. Look, we know that there are a lot of interests here. And part of the challenge, frankly, is that I think a lot of my colleagues on the other side of the aisle are frozen by the fact that the White House is frozen. White House has indicated they might support one, they might not. And that makes it difficult, obviously, to bring folks along. I've had conversations with nearly 3 dozen Republicans in the House who have expressed pretty strong support for the concept, but they're concerned, I think, about where the president comes down.
It's timing. Washington Post. Health insurance costs could spike as bipartisan ACA deal looks less likely with time dwindling. Senate Democrats still haven't released their plan, which would extend the subsidies for an unknown duration. And House Democrats are pushing for a 3-year extension, but it's clear there are not enough Senate Republicans willing to support any extension, especially without significant changes to address GOP concerns about fraud and whether subsidized plans will cover abortion. So the clock is ticking, right, Congressman Conley?
That's right. I mean, we're talking the end of this month, and people are going to see a massive increase in premiums, 22 million people. And who are these people, by the way? And this is a message I have for folks in my own party. A lot of them are the sort of folks that Republicans have been fighting for a long time, like independent contractors who have been really unfairly targeted by the likes of Gavin Newsom in California or the Biden administration, who have impinged on their ability to earn a living. They could see thousands and thousands of dollars of an increase in premium payments. Or small business owners and their employees. They rely on the individual market. And by the way, the impacts will be broader than those 22 million, because if people drop out of the insurance market, then you're going to see costs that will apply to 150 million other people who have employer-based plans.
You say targeted by California Governor Gavin Newsom. You have been, because of Prop 50 on District 3.
You could
if you
say
look
that.
at the redraw that Prop 50 proposes for your district, it's gone. So what's happening to you?
Well, I'm running for re-election, and I'm confident that I'll win. The
Just
challenge,
don't know where yet?
The challenge is they've chopped my district into 6 different pieces. So I'm talking with my constituents about what the best path forward is. But you're right, the governor has targeted me in this case, but we're, I think, not going to let that stop us.
So you're California Democrat, California Republican, but you want to do a deal here. Do you think there is more common ground up on Capitol Hill than we acknowledge day to day, or do you think it's as divisive and partisan as it's been?
Well, I think 2 things can be true. What people are seeing on TV is often true. But look, there are good people on both sides. Let's be very clear, who want to work something out and are serious about it, and I appreciate that Kevin came out very early on and said, look, I want to find a solution, and that's why I called him.
Because the costs go up for Democrats, Republicans, doesn't matter what your party is.
Everybody's impacted. 22 million Americans are Republican, Democrat, Independent. We've got a lot of work to do for a lot of Americans.
So how do you get it done in the time frame?
I think we've been reaching out to people on both sides. Sam, as he mentioned, has talked to several dozen people in our party. We were just part of a bipartisan group that was meeting. So I think that there is enough support on both sides. I'm confident of that to reach a deal. So now it's just a matter of what is that deal going to be? And I think that what we've proposed is the right framework, because it might not appeal to everything that everyone wants, but it gives enough people enough of what they want. It says we're going to provide relief to the people who need it. We're going to pay for it. We're going to do it in a fiscally responsible way. That something like what we're proposing, I think, can be the basis for getting this done.
Which is the definition of compromise. Thanks for coming on Common Ground.
Great.
Appreciate it. You can see all the Common Ground segments on my podcast, Common Ground. Find that and the All-Star Panel podcast under the Bret Baier Podcast, foxnewspodcast.com, Spotify, or wherever you download podcasts. You can also see the discussion on the Fox News YouTube page.
Hey, Sean Hannity here. Hey, click here to subscribe to Fox News YouTube page and catch our hottest interviews and most compelling analysis. You will not get it anywhere else.